Hello, my name is Stephanie, and today I will be performing the drawing up insulin skills video. I'll start by verifying the doctor's orders. I'll verify the 6 rights of medication administration, making sure I have the right patient, drug, dose, route, time, and the right documentation. I will pull up the patient's information in the EHR. I'll verify the order. I'll verify the medications that I pulled match the order. I have gathered all of the supplies. I've entered the patient's room. I closed the door behind me to ensure patient privacy. I will perform hand hygiene. Hi, Mrs. Garcia. My name is Stephanie, and I will be your nurse today. Can you please verify your first name, last name, and your date of birth? I verified with 2 patient identifiers. So, Mrs. Garcia, do you have any allergies to food, medications, or the environment? No, okay. I verified patient doesn't have any allergies. So the doctor has ordered insulin administration, and that's what we're going to be talking about today. I'll perform hand hygiene, and I will apply clean gloves. Thank you so much for your patience. So the doctor has ordered regular insulin and an intermediate acting insulin called NPH. So what is insulin? It's just a hormone that's used to regulate blood glucose levels in patients with diabetes. So what it does is that it helps the body move the glucose from the bloodstream to your cells to be used as energy. Some common side effects of insulin administration are rash, redness, pain in the injection site. Some of the more serious side effects are blurry vision, headache or dizziness, or a change in heart rate, such as palpitations. If you do experience that, please let me know right away. Some patients do complain of stinging or burning. If you do experience that, just be aware that it tends to happen. Do you have any questions for me? No questions. Thank you so much. So we went ahead and checked your blood glucose level. It's 130, and now we're gonna go ahead and grab that insulin. And so 30 minutes after the insulin administration, you can eat. So I'll go ahead and bring you your breakfast. Okay. So I'll go ahead and verify the doctor's order in the MAR, and I'll make sure to verify the medications that I have pulled against the MAR. I'll ask one of the nurses to come in and verify the medication calculations. The doctor has ordered 4 units of regular insulin and 8 units of NPH. When you add that up, you get 12 units of total volume of insulin. So I also asked the nurse to verify that those numbers are correct. And then the next step is to roll the regular insulin vials in between my hands to suspend the insulin and to warm the liquid to room temperature. So it's room temperature when we administer it and it's not cold. And I'll do the same thing to the NPH here. You'll notice that the regular insulin is clear, that's how it should be, and the NPH is cloudy, that's completely normal. The next thing I'll do is I'll clean the top of each insulin vial here with an alcohol pad. Clean the NPH. I'll take the 1 ml insulin syringe here from the packaging. I'll withdraw 8 units of air. 5, 6, 7, 8. I'll uncap this carefully. I'll inject the air to the NPH, making sure that we don't touch the fluid insulin medication in there. At this time, we're not going to be withdrawing anything. So the next thing, we're going to pull 4 units here of air. We're going to inject it here to our regular insulin and draw the 4 units of regular insulin here. All right, so I'll make sure to get rid of the bubbles here. And as I'm doing this, I'll verify that I have the 4 units here of regular insulin in the syringe and verify that I took it from the regular insulin here. And Again, I'll verify against the bar, making sure that everything is accurate. So I have the 4 units here of regular insulin. And then the next thing that I'll do is that I'll take the NPH here. Insert that. And as I'm doing this, I'm making sure not to push any of the regular insulin into the NPH. And here, I will be extra careful not to overdraw the insulin here. If I do, I have to start all over again. And here I'll verify that I have 12 units. And I'll be doing this slowly, again, being careful not to overdraw. Right. So then we got the 12 units here. And if I prepare this away from my patient, I'll go ahead and cap this carefully. I'll label the syringe with our medication name and our dose. And I'll go ahead and administer that to Mrs. Garcia, my patient.